I'd say the other thing we've also been getting probably pretty commonly, because everyone is either on their phones a lot more or on their laptops. Most people had a work setup where it was more ergonomic, then they all kind of had to transition to their home and are slowly piecing together a home office. But we've gotten some questions about wrist pain. I know I've dealt with a little bit of not necessarily wrist issues, but it's kind of like, oh, something's starting to feel not right just because my hand's on my laptop, answering more emails, doing more virtual things, as opposed to typing on a regular keyboard and then sending it off. So I felt a little bit of, wrist tingly down into the fingers. And we've also gotten some questions about like, how can Egoscue help wrist pain? And I know Elisa did a deep dive into some carpal tunnel recently.
Yeah.
So if you want to start off with just kind of saying what you experienced in terms of, looking at carpal tunnel and things like that.
Yeah, no, that's a great question. And we had a really great client experience and feedback actually just earlier today, a client with carpal tunnel. And something I think that's important to remember, first of all, if you don't know what carpal tunnel syndrome is, it's when a nerve that passes through the carpal tunnel, which is in your wrist, is compressed. So the space around the nerve is kind of closing in and irritating it. So something to remember about any issue with nerves is that while you feel the pain in a certain area, the issue can be at any point along the nerve's path. And all of our nerves start from the spine. So you can follow and you can do your own little Google search and little anatomy search and follow the pathway of the nerve and just see. So like with the carpal tunnel, if it goes through the wrist down into the three fingers here, but if you follow it up the arm, through the elbow, through the shoulder, to the neck, any issues anywhere along that way, that pathway of the nerve can lead to the symptom. So that's just something to keep in mind, is you might be feeling it in your wrist and your hand, but is there something going on in the shoulder that can be affecting it? And then zooming out even further again, beneath the shoulders, you have your hips, you have your spine sandwiched between the shoulders and the hips. So any dysfunctions or patterns that are not serving you there could then lead to a mispositioned shoulder that can then lead to stress down into the nerve. But this client today, it's been I think 3, maybe 4 sessions with her, and she had the primary complaint of carpal tunnel, and she was very in tune with us addressing the full body. It totally made sense to her. And she just told us today that she doesn't wake up with that like swollen, painful feeling anymore. And side note, she has had sleeping issues for 40 years. She does like sleep therapy, which she said has helped a lot, but she's also sleeping better. So all the positive effects from just making sure things are sitting where they're supposed to.
Yeah, right. Hormonal, like blood flow, right? Hormone regulation, delivery, things that help us relax, right? It's all, if it happens in the ear, it's, it's affected by alignment.
Yeah.
Yeah.
That's cool.
I would also say too, in terms of how we sit, I don't know about you guys, but I notice if I've had a lot of back-to-back Zoom calls or answering emails, I'll start sitting in a nice, even, foot flat, 90-degree, nice position. And then usually about an hour or two, maybe like 2.5 hours in, I'm kind of leaning more to one side. I'm kind of, you kind of fall out of this nice, perfect position, and you're kind of getting a little bit lazy with it. And that'll, put more pressure on one side versus the other. Sometimes a little bit more pressure on the left wrist other than the right wrist. So I'd say similar to, breaking up the day, if you've got a forward head posture, it's also good to, check your positioning as you're sitting at your computer in general, especially if you have noticed like you have a tendency to lean to the right, or you lean to the left, or you're, end up slouched. There's definitely a little quick exercise that you can go to, even without getting up from the chair. You can do knee pillow squeezes. You can do, put a strap around your knees and press out just to help wake up the lower body and get some circulation in there again. And when you have a better pelvic position, you have a better upper back position, especially while you're sitting. And that can also translate to better shoulder position and work its way down the chain as well.
So you're saying it's all connected, right?
It's all connected.
About that, yeah. Cool. Yeah. Lovely. You brought that full circle, from talking about forward head, shoulders to right to wrist. Yeah. That's the line, right? That's just impacted.
Yeah.
For sure.
Do you have anything else to add?
No, I think it's great and very pertinent to what we've been seeing as a therapist in the clinic and what people are experiencing nowadays. So if anybody has any questions, if you're experiencing this or know somebody who is, or not even experiencing pain but just want to correct this for optimization and prevention of pain, feel free to give us a call. We're here to help.